My name's Jamie Clegg. I am Head of Digital Innovation at Milton Keynes University Hospital. Today we've been with Cisco looking at our proof of concept in the Maple Centre that deploys Wi-Fi 7 and RTLS and IoT and OT technology. So at the Maple Centre in Milton Keynes, we've deployed Wi-Fi 7 that has allowed us to look at use cases like real-time location services. So how can staff find bits of equipment? How can we alert when they need assistance to security or that type of thing? How we can sort of geofence at-risk patients like babies to make sure they're not taken off the unit. How we can look at tracking infections across the trust to reduce hospital-acquired infections, as well as things like IoT and OT. So how can we look at what the occupancy of a space is, how it's being utilised, what the air quality is like, what the temperature's like, so that we can use that baseline to inform and measure the efficacy of different digital interventions that we implement.
Awesome. And can you give me a 2-minute summary about how you think using one network rather than multiple networks helps with that?
Yeah, so absolutely. Like our aspiration is big as part of the new hospital programme. It's a once-in-a-generation opportunity to really make a difference and deliver smart, intelligent hospitals. And as such, it's got a broad scope of 49 different digital intelligent hospital capabilities. To deliver that, it's absolutely paramount that we do it in a simplified, rationalised way to limit the amount of different disparate connections, to have a kind of clear infrastructure and foundation that means we can manage it when we take that technology into business as usual, and using our network as a sensor and as this gateway for multiple different types of IoT and RTLS type capabilities is absolutely essential. And of course it's secure by design, so as we bolt all of this additional technology on, we basically don't expose ourselves to additional threats and vulnerabilities. So I absolutely think that kind of secure singular infrastructure is key to delivering an intelligent, smart hospital.
And how do you think linking together estates and health and IT into a single project has changed the way you do things?
Yeah, it's such a good question, because historically the NHS has often been quite siloed. So you might look at clinical challenges, you might look at estates or digital, and actually all of these things converge. So if we look at noise levels in a hospital, for example, we can measure the levels of noise and create a better environment for patients to recuperate in, but then also that's a better environment for staff to work in. Similarly, if we look at things like energy consumption and how we automate how a building responds to areas not being used or utilised, that same technology can allow us to implement things like voice activation for patients with spinal conditions to really empower them and create an outcome of independence. So all of these technologies ultimately converge, and only by engaging all of these different teams can you see all the myriad of possibilities that are there.